USMLE-style question on tabes dorsalis, neurosyphilis. Question. A 50-year-old man presents to the clinic with progressive difficulty walking over the past 6 months. He describes an unstable gait, particularly in the dark, and has had several falls. He also reports shooting pains in his legs and occasional urinary incontinence. His medical history is significant for multiple unprotected sexual encounters in his youth. On examination, he has a wide-based gait, positive Romberg sign, and absent deep tendon reflexes in the lower limbs. Joint position sense is impaired in the toes and ankles. Pupillary examination reveals bilateral pupils that accommodate but do not react to light. Which of the following is the most likely diagnosis? A. Amyotrophic lateral sclerosis, ALS. B. Multiple sclerosis, MS. C. Subacute combined degeneration, vitamin B12 deficiency. D. Tabes dorsalis, E. Friedreich ataxia. Answer. D. Tabes dors. Explanation. This patient presents with progressive sensory ataxia, sharp shooting pain, absent reflexes, and Argyll Robertson pupils, which are classic signs of tabes dorsalis, a late manifestation of tertiary syphilis. Key clinical features of tabes dorsalis: dorsal column and root degeneration. Progressive sensory ataxia, impaired proprioception and vibration sense, leading to an unstable, wide-based gait. Positive Romberg sign, loss of balance when eyes are closed. Absent deep tendon reflexes due to degeneration of dorsal roots. Lancinating, lightning-like pains, due to dorsal column damage. Argyll Robertson pupils, prostitute's pupils, accommodate but do not react to light. Neurogenic bladder, urinary incontinence due to autonomic dysfunction. Pathophysiology. Tertiary syphilis, caused by treponema pallidum, leads to chronic inflammation, demyelination, and degeneration of the dorsal columns and dorsal roots. Loss of proprioception and vibration sensation leads to sensory ataxia. Degeneration of dorsal nerve roots causes absent reflexes. Diagnostic tests: CSF-VDRL and FTA-ABS confirm neurosyphilis. MRI may show atrophy of dorsal columns. Serologic tests for syphilis: RPRT-PPAF treatment, IV penicillin G for 10 to 14 days. Why not the other options? Differential diagnosis, key differences from tabes dorsalis. A. ALS has UMN plus LMN signs, no sensory deficits, no Argyll Robertson pupils. B. Multiple sclerosis, MS, relapsing remitting optic neuritis, spasticity, bladder dysfunction, may have proprioception loss but has brisk reflexes. C. Subacute combined degeneration, B12 deficiency, affects dorsal columns and corticospinal tracts, brisk reflexes, associated with megaloblastic anemia. E. Friedreich ataxia, early onset ataxia, associated with hypertrophic cardiomyopathy, scoliosis, and genetic inheritance, GAA trinucleotide repeat. Take-home point: tabes dorsalis is a late manifestation of neurosyphilis characterized by degeneration of the dorsal columns and dorsal roots, leading to sensory ataxia, absent reflexes, lancinating pain, and Argyll Robertson pupils. Diagnosis is confirmed with CSF-VDRL, and treatment is IV penicillin G. Would you like a follow-up question on syphilis testing?